And now let's go to the Florida Hospital for Health Connections.
Hi, I'm Kathy Albritton, Marketing Director for Florida Hospital Heartland Division, and welcome to Health Connection. Our guest this evening is Becky McIntyre. Becky is a registered nurse with Heartland Home Health Agency. Hi, Becky.
Hi, Kathy.
And the first thing I wanted to ask her about tonight with Heartland Home Health is that they deal with the elderly people often.
Correct.
What are some of the problems or some of the challenges that you face dealing with elderly people?
It's been interesting, Kathy. Over the years that I've been in home care, I've seen a change in the population that we have here in Highlands County. We've always had the elderly, but it seems like now more of their children are living in other states, and then the people come here to Sebring or Highlands County to retire. And so one of the challenges that we face is these patients are here and they have no one to help them make some of the most serious decisions that they need to make regarding their health care.
What are some of the decisions that we need to think about if you have maybe elderly parents moving to the area? What are some of the preparations and some of the things that we can do?
Well, Kathy, we've prepared a list that we like to give to people during some of our health education talks that we do in the community. And one of the first things that we encourage people to do is to make a list of all of their banking accounts, where they're located, the types of accounts they are. Another item is to make lists of all their stocks, their bonds, their certificates of deposit. And when I say these things, they should put them all together in one special place where their children know where they are, so that they're not hidden when the children are trying to take care of them. Maybe their parents are ill. Things like your insurance policies, the names of the company, how to get in touch with the company, what the policy numbers are. Something very important is also deeds and lists of all of your properties that you may have. Loan and lien information are also important. Social Security numbers and Medicare numbers are very important. Your military history or any affiliations that you may have, or discharge papers, and an up-to-date will is very important. Another suggestion would be a durable power of attorney. And this is where, as a family, you would go to an attorney and decide who you would want to make health care decisions for you, should you be unable to make them for yourself. We suggest that you always make those before you become ill. Of course, once you are ill, it's very hard to make those decisions, and it's very stressful for the family. Last of all is instructions for your funeral. None of us like to think about that topic, but it's a gift to the family. If you will go ahead and decide that now, where you would like to be buried, how you would like your funeral to take place. Some of those things are not topics you want to talk about often, but they are very important.
The Florida Hospital Heartland Home Health Agency, if someone gives you a phone call, will you go into their home, or can they come to the Heartland Health Agency and pick up paperwork that would let them know this stuff?
Certainly. Kathy, we do free evaluations in the home, nursing home, wherever the patient and family are. We will be glad to go and talk to you about the available services that we have at no obligation. And with that, you can make an informed decision about what type of health care you would like for your family.
What are some of the things that somebody would look for? Because I know there's many home health agencies. How do you make a decision about which one is right for you?
Very good question. I know many of you have probably seen in the newspaper horror stories of people who are hired out of the newspaper to do caregiving, and then you find things like you've had bank accounts tapped into, there's items that are stolen. And so we at Heartland Home Health try to make sure that you're protected from any of that type of thing happening. Our agency is licensed and bonded and insured, and those are things you would want to look for in any agency. We have a registered nurse who supervises all the care and is available 24 hours, 7 days a week. We also do drug screening on our employees, criminal background checks, and we supervise our employees very closely.
Now, if someone was to sign up for some of these services, is there some help with the services? Does insurance cover any of them?
Certainly. Many people are unaware of the coverage that they have under their long-term care insurance policies that they may have purchased. Many people feel that those policies only cover nursing home, but if you will investigate a little further, you'll find that many of these companies do cover what we call custodial home care, or that's private duty care, and that can be not only in your home, but maybe in the hospital for private duty care or in a nursing home.
How do I know if this is the right agency for us?
Well, I suggest you do your homework and shop around. All agencies have a little different personality, and you need to look for one that fits your family's needs. What we call a plan of care, or how your care will be provided for your family, is something that you should give us a lot of input on, and it's your decision as to how much care you receive and what is done. An agency should always tell you that these are things that you can make a choice on, and if you would like to stop services, you may do so at any time.
Thank you for joining us for Health Connection, and please join us next week as we have another segment from Florida Hospital.